Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on Hematology and Oncology. Let's get started with question number 1. For the following case, which of the following is the most likely cause of this patient's polycythemia? A. Polycythemia vera. B. Hypoxic erythrocytosis. C. Renal disease. D. Occult neoplasia. E. Relative erythrocytosis. The case scenario is: a 63-year-old woman is hospitalized because of dyspnea on exertion and generalized fatigue. She has been hospitalized 3 times during the past year for heart failure exacerbations. Her other medical problems include essential hypertension for 20 years, myocardial infarction at the age of 58, and hypercholesterolemia. She has a 36-pack-year smoking history in addition to a 10-year history of alcohol abuse. Physical examination reveals tachycardia, distended neck veins, bilateral crackles on lung auscultation, a third heart sound on cardiac auscultation, and pedal edema. The appropriate therapy is initiated. On the 3rd day of hospitalization, her hematocrit level increases to 50%, up from 44% on admission. An arterial blood gas analysis shows an arterial oxygen partial pressure of 70 mm of mercury. A CR-tagged red blood cell infusion indicates normal red blood cell mass. The question is: which of the following is the most likely cause of this patient's polycythemia? Your options are: A. Polycythemia vera. B. Hypoxic erythrocytosis. C. Renal disease. D. Occult neoplasia. E. Relative erythrocytosis. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is E, which is relative erythrocytosis. This question is designed with the focus to assess your ability to make a diagnosis. Polycythemia, or erythrocytosis, is defined as a hematocrit level greater than 52% in men and greater than 48% in women. It may be the result of a true increase in the red blood cell mass, absolute erythrocytosis, or decrease in the plasma volume, relative erythrocytosis. In a patient with erythrocytosis, the following tests can help determine the cause. 1. Absolute versus relative erythrocytosis. Hemoglobin and hematocrit levels cannot accurately differentiate these conditions. Direct measurement of the RBC mass is necessary. An increased total RBC mass indicates an absolute erythrocytosis. A normal RBC mass indicates a relative erythrocytosis. This patient does not have an increased RBC mass and is likely experiencing relative erythrocytosis due to aggressive diuretic therapy for her heart failure exacerbation. 2. Primary versus secondary erythrocytosis. Serum erythropoietin levels can be used to differentiate primary from secondary erythrocytosis. Primary erythrocytosis is associated with low erythropoietin levels and is caused by myeloproliferative disorders such as polycythemia vera. Secondary erythrocytosis is characterized by increased erythropoietin levels due to chronic hypoxia from high altitudes, smoking, or chronic obstructive pulmonary disease, or abnormal secretion by neoplastic or otherwise diseased tissues. 3. Hypoxic versus other causes of secondary erythrocytosis. Measurement of the arterial oxygen saturation is important to exclude hypoxemia as a cause of the erythrocytosis. Oxygen saturation less than 92% can cause secondary polycythemia. Oxygen saturation, measured as a percentage, should not be confused with arterial oxygen partial pressure, measured as a partial pressure in millimeter mercury. If you choose any option other than E, you are wrong. Let's briefly discuss the other options. A. Polycythemia vera. Polycythemia vera is a myeloproliferative disorder associated with marked erythrocytosis and more modest increases in granulocytes and platelets. A low erythropoietin level is characteristic, along with increased RBC mass. B. Hypoxic erythrocytosis. Hypoxia is a common cause of secondary erythrocytosis. Oxygen saturation less than 92% appears to be the threshold for the development of secondary erythrocytosis. This patient has hypoxemia above this threshold, an acute, less than 3-day, increase in hematocrit, and normal RBC mass. None of these features are consistent with hypoxemia-induced erythrocytosis. C and D. Renal disease and occult neoplasia. Renal disease or occult neoplasia can cause secondary erythrocytosis due to abnormal erythropoietin production by the diseased tissue. Workup will reveal an increased RBC mass and an increased erythropoietin level. However, chronic renal disease typically leads to decreased erythropoietin production. Your take-home message from this question is that erythrocytosis is defined as a hematocrit level greater than 52% in men and greater than 48% in women. Measurement of red blood cell mass is necessary to distinguish absolute from relative erythrocytosis. A normal red blood cell mass indicates plasma volume contraction as the cause of polycythemia. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.